Hi everybody, it's Dr. Michele Drake here today, and I'm with Moki, my trusty assistant, our house cat, who is the most awesome cat, and also Nicole is going to help me answer some questions that a lot of you have about dog cancers.
Dr. Drake, is cancer in dogs common?
Yes, cancer in dogs is fairly common. We tend to see a fair amount in dogs as they age, but even sometimes in younger dogs. But for the most part, it's an after 9, I would say, disease that we do see in dogs.
What are the common types of cancer in dogs?
So some of the more common cancers we see, skin cancers, so lumps and bumps that you might see in your dog, mast cell disease. There are other types of skin cancers also, or just underneath the skin cancers. There's brain tumors. There's hemangiosarcoma, is a unfortunately fairly common cancer we see in some larger breeds. Also lymphoma is fairly common. That's a cancer of the lymph system. And bladder cancer, that's probably as many as I can think of right now, but we do see pretty much almost every type of cancer that humans can get. We see that in dogs also.
What are some of the signs and symptoms of dog cancer?
Yeah, so just like with people, quite often people have no idea that they have a tumor growing inside them. Dogs are the same. Many of them don't really have many symptoms, so it's super important to be doing annual exams on your dog. For that reason, doctors actually pick up things quite often. When we palpate your dogs, when we feel your dog's abdomen as part of the exam, many times we'll find a large spleen or a tumor. Doing a rectal exam, we find things back there. Sometimes also lumps and bumps on the body, which many of them are benign, but some are not. And so the only way to know if those tumors are not benign is to put a needle in them and do a needle aspirate or a biopsy of them. The lymph nodes, we palpate when we do exams, we feel the lymph nodes, so lymph node enlargement. So you have lymph nodes all over your body. There are some that are easy to palpate, meaning we can feel them on exam. Oral exams, we find cancers in the mouth and on the extremities sometimes, in the eye. So just really for you, weight loss and breathing difficulty, these are when cancers are really far gone. Otherwise, lumps or bumps are something owners may find that we wouldn't, that you would see before you'd bring them in. So just most important is, being aware of what's going on with your dog, but annual exams are so important.
Why is early detection and diagnosis of cancer in dogs so important?
Well, for sure, if we find cancers early, we can treat them better, just like with people. So there are, like I said, cancers that if we get the signs of them and like feeling them, the lumps or whatever, we can, diagnose them quicker and get the treatment started quicker, and hopefully the prognosis is much better.
How would a veterinarian diagnose cancer in your dog?
Combination of you telling us histories, you guys finding a bump at home, or us finding things on exam. Also, as dogs age, we may want to take chest films as just a survey to have a look, just like we do for us sometimes. Or sometimes we'll do pre-anesthetic things, and we'll see something up with the lab work, which blood work generally does not diagnose cancer, but if something's abnormal, it may give us a clue. If the white blood cell count is very high or the red blood cell count is very low, these can be signs that we just want to look into, and then we can find cancer. So x-rays are important. Abdominal ultrasounds are super important. Sometimes ultrasounds of the chest. Certainly lots and lots of doing biopsies of lumps, needle biopsies, or punch biopsies of lumps that we find on your dog's body to make sure that they're benign, and if they're not, we're going to want to take them off.
What treatment options are available for dogs with cancer?
So surgical is certainly an option. Chemotherapies, pretty much I tell people everything that we have available for humans, almost, we have available for dogs. It really just depends on what the prognosis is, how much you're willing to spend or can spend. And sometimes it depends on, every case is different. I mean, I've had dogs that are really in kind of rough shape, and I'm not going to recommend they go any further with that because I don't think it's going to do the dog any favors. But we do have a lot of amazing treatments that can prolong a high quality of life for your dog. Certainly with things like, mast cell cancers and whatever, if we get them early, we can completely cure them. So, it's important just to, start collecting information and help us be your partner as you go through that with your dog.
Yeah. Okay, last question. What are some possible side effects caused by cancer treatments?
So just like as in humans, radiation therapies and chemotherapies can cause side effects in dogs, and really, I've had both radiation and chemotherapies for a couple of my dogs. One of them had no symptoms. The other one had a lot of symptoms, or side effects, sorry. So it really just depends on the dog. Dogs do tend to tolerate chemo better than humans do. And we do have a lot of medications for nausea and things now that are really great drugs. But still, some dogs can have side effects. So it's just dependent on the pet. So anyway, hopefully that helped answer some questions. But if you have more questions, I'd say most importantly, come in for your annual exam. Let's talk about it. And if we find something, we're here to hold your hand through the process.